We're bringing in Dr. Dan Vick from Oneida Healthcare right now. Doctor, thank you for being on the show. Is Oneida Healthcare ready for an Ebola patient?
Oneida Healthcare has been working very diligently to develop a plan and protocol to treat patients who may have come into contact with Ebola or actually have the disease. In conjunction with directives set out by the Centers for Disease Control and Prevention, as well as the New York State Department of Health, we've been designing and developing and implementing our protocol for treating patients who will show up.
People all across the country are nervous about Ebola, especially now in New York City. Doctor, in your opinion, should people be as nervous as they are about Ebola?
Well, I think that's a good question, and what I've been telling people is that there is a fine line between rational concern and irrational alarm and hysteria. And I think one of the things you have to consider is how infectious is this disease. We know that it is spread through body fluids, but thus far there are no examples of it being spread by respiratory route or mechanism. So that makes it less easy to contract versus the flu, which can be spread in a respiratory droplet fashion and is much more easy to contract. With that being said, you also have to look at the number of cases that have occurred since the virus was first discovered in 1976. And between 1976 and 2013, there were only 1,700 roughly documented cases of Ebola in the world. Now, this year with the outbreak in West Africa, there are well over 9,000 cases. But still, this is not a disease that is readily caught. However, it is a very serious disease and one that has a high fatality rate. So that's why it is important to take precautions to ensure that healthcare workers are adequately protected when they are taking care of patients, and to make sure that patients receive the supportive care and treatment early on to try to help mitigate the effects of the disease and help get them to the point of being cured.